Good day. So for today, I'm going to perform the proper taking of vital signs towards my patient. So first of all, I have gathered all the equipments needed. And after that, I'm going to identify the patient's name through his or her ID badge or by asking the client's name. Hello, good morning.
Good morning.
So are you Ma'am Feka Ferras? Did I pronounce your name correctly, ma'am?
Yes, ma'am.
Okay, thank you for that, ma'am. So, ma'am, what would you like me to call you? Is it by your first name or your last name?
First name, please.
Okay, thank you for that, ma'am Fe.
Thank you.
So, after that, I'm going to introduce myself towards my patient and state the purpose of the procedure. Okay, ma'am Fe, allow me to introduce myself. My name is Eliza Cristalco Ferres, and I'm a nursing student. So what I'm going to do here is to take your vital signs. And for you to be knowledgeable of what is vital signs, it is where we take your body temperature, pulse rate, respiratory rate, blood pressure, as well as your pain rate. So the purpose of this is to measure the body's basic function, and it allows us to assess your well-being. So Ma'am Fe, is it clear for you?
Yes, ma'am.
Okay, thank you for that. So is it okay for you, Ma'am Fed, that I'll be going to check your vital signs?
Yes, ma'am.
Okay, thank you for that, Ma'am Fed. Okay, so since we already state the purpose of the procedure, next is we're going to perform hand washing or hand hygiene before starting. So I have here an alcohol which serves as a sanitizer. Okay, so we are going to start by checking the body temperature of our patient. Okay, Ma'am Fe, I'll be going to take your body temperature. Is that okay with you?
Yes, ma'am.
Okay, thank you. So I'm going to take the digital thermometer, which we'll be going to use in taking the body temperature. Before we use the thermometer, we are going to sanitize it first by the use of cotton balls soaked with alcohol. And in sanitizing, we are going to sanitize our thermometer on a circular motion from the tip of the thermometer up to the digital bar. And we are going to dispose the used cotton balls. Same procedure as we are going to dry our thermometer from the tip of the thermometer up to the digital bar. And we are going to dispose the used cotton balls. After that, we are going to turn on the thermometer, and we can hear a beep sound which indicates that our thermometer is ready for us to use. Okay, so Ma'am Fe, I am going to wipe first your armpit so that I can put the thermometer on it. And I'll be going to lift your sleeves. Is that okay with you?
Yes, ma'am.
Okay, thank you. I'm going to put the thermometer. Okay, so we are going to just wait until we heard a beep sound on it. Just relax, Ma'am Fe. Just a few seconds. Okay, so since that we heard the beep sound, we are going to take off the thermometer and record the result. Okay, I'm going to take off the thermometer, ma'am. Okay, thank you.
Welcome.
Okay, so since that we got the result, we are going to record it on our jotter. And after we put it back on its holder, we are going to sanitize it again. But at this time, we are going to sanitize it from the digital bar up to the tip of our thermometer. So we are going to use again the cotton balls soaked with alcohol. Same manner on the circular manner as well. And we are going to dry it with a cotton ball. Okay, so we are going to dispose the used cotton balls and put the thermometer back on its container or in its holder. The next is we are going to take the vital signs of our pulse rate and respiratory rate. So I'm going to inform the patient first. Okay, Ma'am Fair, so I'm going to take your pulse rate and proceed as well to take your respiratory rate. Would that be okay with you?
Yes, ma'am.
Okay, thank you for that, Ma'am Fair. So be on your comfortable position. Are you comfortable with this? Okay, so I'm going to put my 3 middle fingers on your wrist where your radial artery is located. Okay, so we are done on taking the pulse rate and the respiratory rate of our patient. Okay, thank you for that, Ma'am Feb. We are done taking your pulse rate and respiratory rate. So what I'm going to do next is to record the result of pulse rate and respiratory rate. Okay, so the next vital signs that I'm going to take is the blood pressure of our patient. So I'm going to inform first the patient that I'm going to take the blood pressure. Ma'am Fe, so I'm going to take your blood pressure. Is that okay with you?
Yes, ma'am.
Okay, thank you for that, Ma'am Fe. So I need you to position in a comfortable one so that I can take your blood pressure. I'm going to lift your sleeves. Okay, just for a while. So in taking the blood pressure, you're going to use the sphygmomanometer as well as the stethoscope. Okay, so we need to place the cuff of our sphygmomanometer on the arm of our patient. And then I'm going to locate the brachial artery so that I can feel the pulse of our patient. Okay, so I'm going to inflate the sphygmomanometer until I can feel the brachial artery of my patient. So I'll be using the stethoscope for me to hear the okay, Ma'am Fe, I'll be going to start taking your blood pressure, okay? Just relax. No pressure at all. Okay? Okay, thank you for that, Ma'am Fe. So I'll be going to take off the cuff on your hands. Okay, thank you for that, Ma'am Fe. So after we're done taking the blood pressure of our patient, we need to record it again on our record notebook. And then we are done taking the vital signs of our patient. And we also consider the pain rate as our fifth vital sign. So I'm going to ask my patient if she feel some pain on her body, okay? Okay, so Ma'am Fe, do you feel any pain on your body from 0 to 10? 10 will be the most painful. What is the rate of your pain?
3.
Okay, so Ma'am Fe has a little bit felt pain, so there will be no pain at all, okay? So that's all for taking the vital signs. And before I end, I'm going to do hand washing so that we can be able to sanitize ourselves. Okay, that's all for today. And thank you, Ma'am Fe, for being my patient for today, okay? Thank you.
Welcome.
Thank you. That's all, and thank you very much.